Okay, this is part one of the spine lecture. So what we're talking about here is going to be the axial skeleton, which is the head, the spine, the sternum, the ribs, and the function of this axial skeleton is to protect the organs primarily. It provides protection to some very important and essential organs, such as the heart, the lungs, the spinal cord. And of course, if these organs were susceptible to injury or damage, it could be problematic. The second is that we have to recall that gravity is a constant force on our bodies, and the vertebral bodies and associated structures support the head, the arms, and the trunk against this gravity force. And it is this force of gravity that is going to actually dictate the anatomy of the spine. The axial skeleton also serves as a way to transmit the forces between the upper extremities and the lower extremities. The trunk is the base from which all lower extremity and upper extremity movement happen. So it's very necessary that this is a stable structure so that distal mobility can occur. Without this proximal stability, distal mobility for hand function, lower extremity function is not possible. So let's move on to the curves of the spine. There are two normal curves that everyone has, and that's a kyphosis and a lordosis. Kyphosis is where the spine has the convex portion posteriorly, and lordosis is where the convex portion of the curve is facing anteriorly. So let's start with kyphosis. This is the primary curve. All parts of the spine are in kyphosis when you're in utero. And of course, this is also referred to as the fetal position. So in utero, the baby has to fit into a very small space, and you can ask any mom if that's true. Having the spine in kyphosis allows this to happen. You're able to cram a baby in a very small space by making sure that that the curves of the spine can help fold in on itself. So in utero, the fetal position um, is necessary so that you fit, and this is possible because all the curves of the spine are in kyphosis at this point. So that means that the secondary curves are going to be the lordosis, or the lordotic curvatures. You'll see these at 2 points, at the cervical spine and at the lumbar spine. So which one's coming first? The first lordosis is at the cervical spine. As babies raise their head when they're prone or as they start to crawl, it's very necessary to have a visual field so that you know where you're going, or you know what you're looking at. So as babies start to lift their head against gravity, this lordosis starts to appear at the cervical spine. The lumbar spine then would be the second point where lordosis is seen. And this occurs when there is weight bearing, such as standing or walking. This is because the tension in the psoas muscle helps to develop this curve, and the stress of standing starts to form this lordosis. Both of these curves are adaptations from quadruped to bipedal locomotion. So in the cervical and the lumbar spine, you see lordosis. In the thoracic and the sacral region, you see kyphosis. These curves are offsetting each other as we go from the neck down to the sacrum, and they act to resist axial compression, which is what our bodies feel because of gravity acting on us. These curves are the ones we just described, would be the normal curves that you see, but sometimes you get to see some abnormal curves in the spine. So the abnormal curves in the frontal plane are referred to as scoliosis. This is scoliosis. It can occur in the thoracic spine, in the lumbar spine, or in both. But scoliosis is a frontal plane curvature of the spine, which makes it an abnormal curve. This occurs with rotation of the vertebral bodies, where the spinous processes end up pointing towards the concave side. So it's not just that there's lateral curvature, but there's also rotation of individual vertebral bodies that are part of scoliosis. Excessive kyphosis, or an increase in kyphosis, is problematic when it leads to additional issues or when it's developed from pathologies such as osteoporosis, a chronic poor posture, ankylosing spondylitis, something like this. Excessive lordosis or an increase in lordosis is sometimes seen, which can lead to other pathologies or weaknesses in trunk musculature. So what's going to guide or limit range of motion in the spine? So we have to recall that the spine is not some mythical structure. It follows the same physics as the other joints. The spine is simply a long series of joints like others that you have studied. Sometimes the spine is intimidating for students or even for clinicians, and so we have to keep this in mind that it is simply a series of spines. Now, while the bones certainly look different, it's simply reflecting the necessary function of these structures. So what is going to guide or limit the range of motion? It's this list here: your intervertebral discs, the shape and the orientation of the facet joints, the joint capsule, the ligaments, and the muscles, and we'll talk about each of these momentarily. Next, I want to talk about coupling movements of the spine. This describes the combined movements due to joint orientation and structures that limit range of motion. So motions in the spine occur in combined motions, often referred to as simply coupling or coupling movements. Again, this is due to the orientation of the facet joints, limitation in movement at the discs, the ligaments, and the muscles. Coupling follows two main principles. In a neutral spine, side bending occurs to the opposite side of rotation. So for example, if you laterally flex to the right, rotation is going to occur to the left. In a spine that is either in flexion or in extension, side bending and rotation occur in the same direction. So for example, if you side bend to the left, there is also going to be left rotation occurring simultaneously. As you know, there are 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, and 5 fused to form the sacrum and 4 fused to form the coccyx. What is more important, though, is what the purpose of each of these segments is. What's the function for each of these segments? So at the cervical spine, these segments that make up the cervical spine give us our visual field. The vertebral anatomy of the cervical spine reflects this, as we'll see momentarily, but the main purpose here is that we have a visual field, that we are able to look at our surroundings. The thoracic segments are there to protect, provide stability at the expense of some of the movement. And this mostly occurs via the ribs. And of course, the anatomy is going to reflect this as we see momentarily. At the lumbar spine, the purpose of these segments is to provide stability, to allow for weight bearing, and then to balance some movement. The lumbar vertebrae are going to handle the majority of the compressive forces that are coming through the spine. And so again, the anatomy is going to reflect this. The sacrum is the link from the axial skeleton to the legs. So it's a wedge at the pelvis that helps add stability, and we'll talk about the details here momentarily. And then finally, it's the coccyx, 4 fused segments to form a coccyx, which have no function. All right, so this is a typical vertebra with some of the that shows some of the typical bony landmarks. So let's talk about these and then move on to more specific um, aspects of each. So the pedicle is the segment between the transverse process and the vertebral body. So the pedicle you see right through here, and it's the segment between the transverse process and the body. So this whole little section here is your pedicle. The lamina connects the pedicle to the spinous process. So the lamina is this entire section right here. The spinous process is the posterior projection of the vertebra. The articulating process you see here, each vertebra is going, or the majority of the vertebra are going to have four, two on the top and two on the bottom. And these are the articulating processes. These are going to form the facet joints as we start to add vertebral bodies on top of each other. And then finally here, this is the transverse process, and it's the most lateral projection. So this is your body. This is the large weight-bearing surface, and what we get here in the middle is a vertebral foramen, and this is formed by the border of the body and the vertebral arch, which describes this bony area here. So the vertebral arch and the body form the vertebral foramen, and this is where the spinal cord runs through. All right, so then as we move into the more distinct features of each of the segments in the cervical vertebra, we see some very unique features that we're not going to find anywhere else. So in C1, or the atlas, we see a ring-shaped bone that does not have a spinous process, doesn't have a body, and its main purpose is to support the skull. At C2, or the axis, here we see what's called a dens, or sometimes referred to as an odontoid process. This is a bony protrusion that moves superiorly from the vertebra. This also does not have a body, and the purpose of the C2, and especially at the dens, is for rotation of the cervical spine and the head. C3 through 6 have small bodies and much larger vertebral foramen. The transverse processes have a small hole through them. This is called the transverse foramen, and this is where the vertebral artery travels on its way up to the brain. C7 starts to become a transitional vertebra between the cervical spine and the thoracic spine. So you'll start to see some of the common characteristics that you would see at the thoracic spine while still showing some of the cervical spine. So this transitional vertebra also has a transverse foramen. However, there's no artery that travels through this. And this vertebra also has a very large spinous process that starts to follow the shape of the thoracic spinous processes. The thoracic vertebra have costal facets where the ribs articulate. So these are going to end up forming some joints. The spinous processes of the thoracic spine are very long and they slope downward. And if you've ever had a chance to closely look at a thoracic vertebra, you're going to notice that it does have some striking resemblances to this giraffe down here. The lumbar spine has very large bodies, again because it's going to end up taking the majority of the weight-bearing forces. The discs then are also going to be larger at this section of the spine. The spinous processes of these vertebrae project horizontal as compared to what you see in the thoracic spine. Again, if you take a close look at a lumbar vertebra, you'll see that it resembles this little moose guy down here. The sacrum has pelvic and dorsal sacral foramen, and the first 4 sacral nerves are going to exit from here. And again, this is a bone that is comprised of 5 fused segments. And then finally, the coccyx. Most references list 4 fused segments. It can be 3, commonly referred to as a tailbone. There's not too much to say about the coccyx. Okay, so now that we've covered the anatomy and the differences, we can start grouping these structures and make joints, add some ligaments, and describe some motion. So the anterior elements are those that are used for weight-bearing purposes. So here we have a list of what makes up the anterior elements: the vertebral body, the intervertebral discs, the ALL, which is the anterior longitudinal ligament. This covers the front of the vertebral bodies, or the anterior aspect of the vertebral bodies. It also has attachments to the annular fibers of the disc that we're going to talk about momentarily. It's a broad ligament, much broader than the PLL, and because of where it runs on the anterior part of the vertebral bodies, it is going to limit extension. The PLL covers the posterior aspect of the vertebral bodies. This is a much narrower ligament compared to the ALL. It does limit flexion somewhat, but the tensile strength is not nearly as high as with the ALL, so it's not going to be such a big contributor to limiting flexion. The disc is comprised of 2 main parts: the nucleus pulposus and the annulus fibrosus. The nucleus is a hydrophilic structure, so it imbibes water. It's a gel-like substance which is comprised of 80% water. What it does is that it allows the disc to serve as a ball bearing between vertebral bodies, and that's where the movement comes from. The vertebral bodies are able to glide over this structure as you would find in a ball bearing. The nucleus does respond to forces from different postures of the spine. So when you're in weight bearing, standing or walking, water is pushed out as pressure changes. So every time you are weight bearing, water is pressed out of the discs. So this does cause, as the day goes on, it does cause the discs to have a decrease in height from the time you woke up in the morning. When you're in a non-weight bearing position, like lying down or asleep, then because the disc is hydrophilic, it is going to imbibe with water, and that's what's going to make it swell back up to its height. In fact, it's going to gain height because there is no force forcing the water out. So in the morning, you are a little taller, about 1 centimeter to 2 centimeters. And then as you are weight bearing throughout the day, that water gets pushed out. You shrink a little bit, and the process repeats the next day. The nucleus is avascular and also aneural. And as you age, the nucleus pulposus will desiccate, and this can contribute to some loss of mobility at the spine. The annulus fibrosus is a series of fibrocartilaginous rings that enclose the nucleus. You'll find that these are bigger in the lumbar spine, and the orientation of the fibers withstand the forces from the different spine postures to contain the nucleus. There is a table in your book that would probably be very helpful, and it describes some of the forces that are placed on the disc with different positions of the spine. So I would encourage you to go and look that up so that you can see what positions place the least amount of stress on the spine and which ones are going to place the greatest amount of stress on the spine. The outer 1/3 of the annulus fibrosus is innervated and is vascular, and because of lifestyle postures that we are in most of the time, the posterior and posterior lateral walls of the annulus fibrosus will weaken with age. From these anterior elements, we can start to form the intervertebral joints. So the discs are firmly attached to the vertebral bodies via the vertebral end plates. This hyaline cartilage plate merges with the annular fibers and with the vertebral bodies and makes a very firm connection. This is a cartilaginous joint, and it allows some movement between the vertebral bodies in various directions. So now let's talk about the remaining structures and how they form the posterior elements. The vertebral arch, which again is made up of the pedicle, the lamina, and the processes, spinous and transverse, and the articulating facets, make up the border of the posterior elements. So you'll see the list of structures that help make this a very stable structure, and we're going to start to describe these ligaments first. So the ligamentum flavum connects the lamina of all the vertebrae from C2 down to the sacrum. It was given the name because of the yellowish characteristic. So flavus is the Latin term for yellow, and it's yellow because of its high elastic content. It is found on the anterior aspect of the lamina, which also covers the joint capsule of the facet joints. So again, this is a continuous ligament from C2 down to the sacrum on the anterior aspect of the lamina. It resists or becomes very taut with flexion. The interspinous ligament is a continuation of this ligamentum flavum, and it connects the adjacent spinous processes. So as the name implies, it is found between the spinous processes. The supraspinous ligament is a continuation of the interspinous ligament. It is stronger and more fibrous, though, than the interspinous ligament, and this attaches the tips of the spinous processes, and this is also continuous with the thoracodorsal fascia. So the interspinous and the supraspinous ligaments also resist forward bending. In the cervical spine, the supraspinous ligament is more expansive ligament, and it's referred to as the ligamentum nuchae. The intertransverse ligaments connect adjacent transverse processes. The posterior elements help form the facet joints. These are also known as apophyseal or zygoapophyseal joints. Most vertebral bodies will have a superior and inferior articulating process. The inferior articulating process of one vertebra with the superior articulating process of the vertebra below it form the facet joint. So when you have two vertebrae, one stacked one on the other, you're able to form two facet joints. These are gliding joints and are covered in a joint capsule. These joints control movement of the spine. So they determine the amount of motion that's permitted, and they also protect the discs from excessive shear or extremes of plane movements. The orientation of these facet joints in the various segments of the spine influence the movement there.